Hello, my name is Hannah Schulz. I'm a dual doctor of pharmacy and master public health student. I completed my APEX project during a pharmacy rotation at the Department of Health Services. My project focused on the appropriate assessment and treatment of patients with dementia in Wisconsin skilled nursing facilities. Dementia is a condition that involves memory loss, cognition decline, and functional limitations that typically affects older individuals. Patients with dementia not only suffer from memory loss and reduced capacity to perform activities of daily living, but about 80% of patients also experience the behavioral and psychological symptoms of dementia. Some of these symptoms include agitation, aggression, hallucinations, delusions, wandering behaviors, or sleep disturbances. Antipsychotics are commonly prescribed for these behavioral and psychological symptoms. However, antipsychotics are not FDA approved for use in patients with dementia. All antipsychotics carry an FDA-issued black box warning for increased risk of death for geriatric patients. Antipsychotics also have many side effects, but older patients are more at risk for these side effects, including further cognitive decline, falls, and sedation. Many patients with dementia reside in skilled nursing facilities. In 2012, the Centers for Medicare and Medicaid Services created the National Partnership to Improve Dementia Care to reduce antipsychotic use in nursing homes across the United States. Since 2012, the partnership's efforts resulted in considerable reduction in antipsychotic use in skilled nursing facilities across Wisconsin and the United States. However, not all Wisconsin skilled nursing facilities have decreased their antipsychotic use since 2012. Some facilities have had no change or even increased antipsychotic use. The overall goal of my project was to reduce further inappropriate antipsychotic use in long-stay patients with dementia living in skilled nursing facilities. I completed my project in the Division of Quality Assurance Department at DHS, which is where about 100 state inspectors work as well. One of the main drivers of reducing antipsychotic use in facilities is through state inspection and monetary fines for inappropriate antipsychotic use. There are strict federal regulations and clinical guidelines around restricting antipsychotic use in dementia. I created a clinical decision-making tool and an associated training for state surveyors to rely on during state inspection. The training will assist inspectors in analyzing antipsychotic use, and it will allow them to educate and share the tools with facility staff during their inspection. The tool assists in decision-making and leads readers through a series of standardized questions and provides a pathway for next steps of therapy. The tool is 3 different pages and focuses on many different domains to assess before starting antipsychotics for dementia symptoms. I also created a 45-minute training video for the state inspectors. CMS required that a new dementia training was provided to the state surveyors. It was required so that it would better support their analysis when determining if antipsychotic therapy was necessary for patients. The video covered the federal regulations and clinical guidelines that are recommended for antipsychotic use in dementia. These are some of the areas I talked about in the training video. As a pharmacist, the interventions involving drug treatment are downstream, which is different from public health where interventions are very upstream. In this project, the focus was mainly on reducing inappropriate antipsychotic usage in dementia, which is responding to a poor outcome that has already occurred. However, I realized that even though manipulations of drug treatment interventions are downstream, and we wish patients with dementia were never started on inappropriate antipsychotics, optimizing non-drug and medication therapies can prevent future poor outcomes, which mirrors more of the upstream intervention model. Thank you for listening. If you have any questions, you may email me. Thank you.